As a young lady, there are family planning methods you should never use, and I'm going to be explaining them in this video. Before going further, let me start by explaining the types of family planning methods we have, the major ones we have, so you can know the ones that are good for you and the ones that are not good for you. Because the complaint I keep getting from most ladies is, after taking family planning pills or family planning methods, they find it difficult to get pregnant. And most of them also find it difficult to have a regular menstrual cycle. And this is all because ladies don't know the right family planning method to use, and that's why I'm making this video. So make sure you share this video to your friends so they can also get this knowledge. You might be helping them and they'll appreciate you at the end. Now, one of the major family planning methods we have is IUD, which is intrauterine device. This device is placed inside the uterus to prevent pregnancy, and it has an efficacy of either 1 year, 3 years, 5 years, or 10 years, depending on the type you're using. And there's another one we call implant. Now, this implant is a device that's been attached under the skin, mostly at the arm, which help in preventing pregnancy. And this one lasts for 3 years. There is the hormonal injection, which is very, very effective. And this one lasts for 2 months or 3 months, depending on the type you're having. We have different types of them, from no-restrict, depot, and different types like that. They are all effective. And there is the permanent method of family planning as well. This one, if you use it, you will not get pregnant again. It's not reversible. Now, this method involves 2 different procedures, either the one we perform on the women or the one on men. Now, the one on women is called the bilateral tubal ligation, where the fallopian tubes are being cut and tied. Now, when they are being cut and tied, the egg being produced cannot come and be fertilized, so the woman will not get pregnant again. Now, the one of men is called vasectomy, whereby the vas difference, there's a particular tube where sperm cells pass, will be cut off. So the man will be releasing, but sperm cells will not be released. The man will just be releasing fluid, where you'll be seeing a kind of whitish stuff, but it's not sperm. And that man cannot pregnant a woman again. And that's why we call it a permanent method. So there's another one we call vaginal ring. Now, this vaginal ring is a particular type of ring, a specialized ring that's been placed in the vagina to prevent sperm from functioning. And there is this common one we all know, which is called condom. Now, there is the male condom and there is the female condom. The male condom is the one we all know. And there's what we call the emergency contraceptive. This one is just like a plan B. It's only being used when you forget to either use condom or when you forget to take your pills and you have sex which is not protected. And that is why it is called emergency contraceptive. The normal postnatal 2, LR1, Hormonal, and other pills like that which you normally use to prevent pregnancy immediately after sex. Postnatal 2 can be used effectively after 72 hours of having an unprotected sex. LR1 can be effectively used within 5 days of an unprotected sex, and the other one, Hormonal, can effectively be used within 3 days of an unprotected sex. There's another one again that is very, very effective for you and I. It's called abstinence. Abstinence is if you stay away from sex during ovulation or you stay away from sex at all. No sex, no pregnancy. So you can stay away from sex and you'll be assured of staying away from pregnancy. Now, the other last one which I'll be explaining to you is what we call withdrawal method. But this method has a high failure rate because you might claim to have withdrawn your penis from a woman's vagina and some sperm will leak inside, and that little sperm that leak inside can pregnant a woman. No sperm can be belittled. No matter how little it is, it can pregnant a woman. So withdrawal method is a process whereby a man withdraws his penis from a woman's vagina when it's about releasing sperm inside her vagina. Having said all this, let me now recommend to you the ones you should use as a young lady who is not married and the ones which you should not use. Now, one of the ones you must not use is the IUD, intrauterine device, the device they put inside the uterus. You must not use it as a lady who is not married. And secondly, you must not use implant, the one which is being implanted under your skin, mostly at the arm. You must not use it as a lady who is not married. And the other one which you must not use is the hormonal injections, because most ladies keep saying they have been using injections, and it's very wrong because that's why you might not even get pregnant in future, because it can cause severe damage to hormonal settings in the body. Now, the other ones that you must not also consider as a lady who is not married is the permanent method, where they'll cut your bilateral tubes, your fallopian tubes. Don't consider that method. And as a man, you must not also consider your vas difference being cut. Don't consider that particular family planning method. The other one you must not use as a lady who is not married is the vaginal ring. Don't use vaginal ring because the side effects might not favor you as a lady who is not married. Now, explaining the ones I will recommend for you to use, and one of them is condom. Condom is very, very effective for you who is not married. Use condoms. The other one is emergency contraceptives, but mind you, they are only being used as option B. Use them only when you forget to either use condom or when you forget to use other family planning methods. Now, the other one I also recommend is abstinence. You can stay away from sex if you don't want to get pregnant. And the last one is the withdrawal method. Of course, if you don't release sperm inside a woman's vagina, she will not get pregnant. But mind you, this method have a high failure rate, so you must be very careful on how you use this particular method. Don't forget, before considering any of these methods I've explained in this video, do well to consult a doctor so you can get the best method that is fit for you, because the one that Abigail will use might not be the one that Precious will use. They all have different body system, so always go for medical checkup before starting to use any medical contraception. So if you enjoy my video, do well to share this video to all your friends, and also make sure you follow my page so you can be getting more videos like this. Thank you for watching this video. See you next time.